This is a 59-year-old woman who was diagnosed with an ER, PR, and HER2-positive breast cancer, stage 3, and she ultimately needed an axillary lymph node dissection. I'm Dr. Amani Jambakar. I'm a fellowship-trained breast surgical oncologist. This is a made-up case, but similar to patients my colleagues and I have seen. This patient felt a lump under her breast for about a month, and she realized it was not going away. It didn't feel mobile within the breast, which was similar to how cysts in her breast had felt, and she decided she needed to get in to see her PCP. It took another 3 months to see her PCP and get a mammogram ordered, and when she had the mammogram done, this is what it showed: a 3-centimeter mass right underneath her nipple. Then had an ultrasound, and when they looked at her lymph nodes, they saw that there were 4 lymph nodes which looked like this. These lymph nodes are completely black and have what we call a thickened cortex. She underwent a biopsy with the ultrasound of both the breast and the largest lymph node, and both of them confirmed a grade 3 ER, PR, HER2-positive breast cancer. Her medical oncologist explained that she would benefit from getting chemo and HER2 blockers first, and one of the reasons was so that way she wouldn't need to have all of these lymph nodes removed or an axillary lymph node dissection. The hope was that her lymph nodes would respond and look normal, and she would only need to have 1 to 3 removed after getting chemo and the HER2 blockers. She had 6 cycles of 2 chemo drugs as well as 2 HER2 blockers, and after the end of it, she had an ultrasound which showed that her lymph nodes still looked like this. At that point, both her medical oncologist and her surgeon agreed at their multidisciplinary tumor board that the best thing for her would be to do an axillary lymph node dissection because she didn't have the response they were expecting in the lymph nodes. Her surgeon explained the risk of lymphedema or permanent irreversible arm swelling after removing all the lymph nodes under the arm. Her surgeon explained the results from this randomized controlled trial and explained that because her BMI was over 30 and she would likely need to get radiation to her lymph nodes, she was at higher risk for lymphedema. And also, if her surgeon had to remove more than 15 lymph nodes, that would also increase her risk. She had the surgery, she had a mastectomy and an axillary lymph node dissection, and all of these lymph nodes were removed. Her final pathology showed that her surgeon had removed 10 lymph nodes. She then underwent 6 weeks of radiation, and 6 months after that was able to get reconstruction and have her breast rebuilt using her own abdominal fat. She was also started on hormone-blocking pills as well as another type of pill called a CDK4/6 inhibitor, and 5 years later, she's still cancer-free.